Hello, and welcome to Chagpar MD. I'm Dr. Anise Chagpar, and this week I have a special guest. Linda Gottlieb is a trainer. She actually did a lot of the work for some of the clinical trials, really looking at exercise as part of a way to maintain an ideal body weight after breast cancer. And she's here with us today to share some of her tips and tricks on how to stay healthy during survivorship and incorporate physical activity into your daily life. Thank you so much for joining me, Linda.
Well, Dr. Chagpar, I'm so thrilled to be here. I know I could talk all day about exercise and its benefits, but
Why don't we start with why is exercise important after a cancer diagnosis? I mean, I think for a lot of people, first of all, the shock of getting cancer is the first thing that they have to deal with, and then there are all of the treatments. And so, adding exercise as yet one more thing into the very long list of things that people need to worry about might seem onerous. So why is that important?
that is a super great question. And it's one that I have dealt with and helped people understand for a decade plus now. And it's really, there's a couple of things. First of all, what we have learned in the past 10 to 15 years is how important exercise is for not only a cancer survivor, but for everybody, right? So we all understand, if you were taking yourself as the normal population, how important exercise is. So when you do, as you mentioned, it's such a scary moment. We've all been through it or actually know someone close to us who've been diagnosed. And it's a heart dropping moment. The world stops. And I have had people say to me, what? Now you're going to tell me, after I have to deal with this in my head and my body, that exercise is now something that you want me to do? And I get a laugh when they say, I'm no Lance Armstrong. And Lance Armstrong actually rode Tour de France after being a cancer survivor, created Livestrong, which is a great organization. And I always try to tell them, no, let's bring it back to regular, normal people. The reason why a cancer survivor wants to approach exercise as part of what they can do for themselves, and this is an important point, versus what you and all the other practitioners are doing as a part of their circle of care. An individual can be part of that, and critically important part of the circle, to actually do something for themselves instead of feeling like things are happening to them.
Mm-hmm. Very empowering for people to kind of take the reins of their own health and do something that's important. Tell us a little bit more about has exercise really been shown to be beneficial in terms of reducing cancer recurrence and that kind of thing? Like, why is it important? Why should people going through cancer treatment add this as one more thing that they need to do?
Another great question, and a really important one. So as a preventative, to be healthy with more lean muscle than fat is critical. And also there's the let's keep ourselves leaner. Let's move our body so we know we are going to get better sleep. Exercise has long been known to be one of the best ways to combat anxiety. And I don't think there's anyone that's heard the cancer diagnosis for themselves, a family member or friend, that isn't anxious about the future. And the evidence is clear, Dr. Chagpar, that exercise has a big piece in reducing the risk of recurrence. So I think that for all of those things, and let's throw in, while you're in treatment, nausea, while you're in treatment, neuropathy, a lot of work has been done with lymphedema. So these things are real for a lot of folks during treatment. These are all great reasons. And oh, by the way, you're going to feel better every day of your life, which is what we're talking about, quality of life.
So let's dig into a little bit more of your specialty, which is, how do you actually motivate people to exercise? So, people have all heard about the benefits. We've talked about that quite a bit in terms of, your physical and mental and emotional well-being, as well as reducing your risk of recurrence. but actually incorporating physical activity is something that might be difficult for a lot of people, especially if they haven't been active before. So I guess the first question is, how much physical activity do people really need? I mean, are you talking about taking people who have, you know, heretofore lived a very sedentary life and, telling them to run marathons? Or how much exercise do people need, and how do they start? What are the first steps to really getting the physical activity you need?
Well, I appreciate that comment because I know that that's running in a lot of people's minds. If you tune into any television show, you don't need to be an extreme athlete to get the benefits of exercise, and it's a great point. The first thing to think about, and especially for folks that haven't really enjoyed exercise or been an exerciser for their whole life, is to just try to avoid inactivity. So what does that really mean? We sit a lot. We may be in treatment. I've worked with folks that had difficulty picking their head up off the sofa on uh, during treatment. So it would be impossible for them to jump off the bed and decide to, run around their block. But it might be possible for them to get themselves to the front door to check the mail, or to walk to the mailbox on the street, or to walk from the bedroom to the kitchen and stand and move a little bit more inside their home on days that they're really not feeling well. And on days they're feeling pretty good, get outside, enjoy nature. I like to call it green exercise. We get so much when we're just walking around our yard, enjoying the flowers that have changed, just getting ourselves a little bit more activity in our life. And certainly at that point, if you were a gym goer or if you were one of those extreme athletes, the first thing I hear is, when can I get back to exercise? And that's a great question to talk to your clinician about. Most people forget to ask that question and then assume they can't go and move. I've seen lots of cancer survivors ask me, you mean I could do I love tennis. And I said, well, ask your doctors, when can you be approved to get back on your regular exercise? And they're so happy to be able to get back into what they love to do. One thing that's really important right now is COVID. And so, many folks are not only fearful about moving in general, but perhaps they did go to a gym, or maybe they were involved in a yoga class, and they're concerned about either returning there and all the inherent difficulties about social distancing. So it's important to know that you can move right in your house. You can use a walk video on YouTube. I love Leslie Sansone. She's not 20, and she can get you moving right in your home. So if you need to have your hand on something to support you, or you want to stay home because you feel more comfortable and you feel safer, these are all things you can do right in your home space. So I tell people to start are, not where you were, and perhaps you will get back to being the tennis player or biker or swimmer. But when you're going through treatment, there's a lot of things going on. And the first thing you want to do is empower yourself to know that today is one of your beautiful days of your life. And what can you do today? Move your body a little bit more than you did yesterday.
Yeah. The trials that you were involved with Lean and with Walk, they really focused on mainly walking as a form of
Yes.
physical activity. Can you talk a little bit about the guidelines that you were using in those trials, how many steps people were supposed to do, or whether there really was any defined regimen, or whether it was, do 1,000 more than you did before? Um, and how people might be able to, incorporate simple walking into their lives to see the same kind of benefit that those trials showed.
Yeah, so in all the physical activity trials that I have worked on, and really with all the folks in the years that I've worked with individuals, 150 minutes a week has been pretty much the standard for aerobic or cardiovascular activity. 2 to 3 times a week strength training. And to be honest, cancer survivors have that same recommendation, which is, you might say, how could that really be? But the reality is it's work toward that time. So if you weren't doing, let me just back up. Most Americans do 3,000 steps a day. So we would love cancer survivors to do 10,000 steps a day. Is that going to happen? Some days maybe, some days maybe not. So really just understanding where you are and how can you increase your steps. And we used to use the 10% more than yesterday. So if you had 3,000 steps today and tomorrow you do 3,300, that's fantastic. And so I think that we as humans want to go full out bore. And we just want to, if we're going to do this exercise thing, we're going to do it. But really, I like to encourage people to underestimate and to just give themselves a break. So therefore, if they don't make 10,000 steps one day, they don't feel like they missed out or they didn't do what their exercise prescription was, but they look and say, wow, I just wasn't feeling so great. Fair. But if it's because you were binge watching Netflix, maybe not so good. So again, it's very personalized. And that's one thing that's really important as well, Dr. Chagpar, is that for folks that are new to exercise or ones that were big exercisers but now have to maybe bring it all back a little and start differently during treatment and post and survivorship, working with somebody who understands what kind of cancer they had, what kind of treatments they had, understanding themselves as an individual. Are they the kind of person who's a type A that wants to go out and do everything? Or do they need a little bit more coaching and encouraging? I worked with a lot of folks and that really never exercised at all. So we had a log and I asked them to keep the log and write down what got in their way. And the next time we got a chance to talk, we talk about what was that challenge? Oh, my husband couldn't bring me to the track that day. Okay, let's work on some things that you could do in your home. So a lot of it is taking what your specific individual issue is and just let's create some fun, modified, safe exercises that you could do. So at the end of the day, you feel like a hero that you really are. And building on that will give the person an opportunity when they come back to see you as their surgeon or another clinician to say, hey, I'm moving more. And the conversation is much more positive, uplifting conversation than this thing is happening to me and there's nothing I can do to help myself. Yeah. So I get so inspired. I have many people from around the country that still communicate with me after 5 and 6 years being out of the clinical trial that still are moving and understand the value. And that's the consistency factor.
And that is so critical, really. It's about making those good habits that are really going to last you a lifetime. Linda, thank you so much for being my guest here on Chagpar MD. I hope all of you enjoyed this video and walk away with some tips and tricks that'll make you more active. If you did like it, please like and share. Be sure to subscribe. And until next week, this is Dr. Anise Chagpar wishing you all a safe and healthy week.